All right, now we are going over our golden donning and doffing of intubation and extubation PPE. So Tracy is doing her sort of pre-donning check. She's in surgical scrubs or hospital issue scrubs. She's got her Vocera on where it's accessible under her gown. Good. And all of her extra junk is emptied out of her pockets. Hair's up. She can now put on her N95 mask. Smoothing it down over her nose with the two hands, one on either side, using fingertips. Not pinching at the bridge. It's high up over her nose and low down under her chin. And her hands are being held around the edges of her mask to do both positive and negative leak tests. Feels good. She didn't feel any air movement. Now goggles. Make sure they're nice and snug so they're not going to slide around on you while you're in 337. We're now putting a surgical mask with attached visor over the N95. These attached are being reserved for, I think it's backwards. There you go. Yeah. These ones are being reserved for intubation procedures. There's not many, but it provides the best directional protection. So being very, very careful not to compromise the seal of your N95. The bottom of it can be pulled down a little bit further over, over your N95. There you go. Now the bouffant or bandana style hair protection. Making sure all of your hair is tucked in and it's covering the entire of your ears. And then it's just tucked by your right eye, just above. Put it back. There we go. And operating room style hood with ties. And it's just one single tie at the back. Making sure that that hood is tucked behind the visor, which Tracy has. Good. We're going to be applying a total of 3 layers of gloves. The first layer is a surgical glove. So this one is going under your gown. You're going to choose your size that is relatively form-fitting. Right. So pull those cuffs up nice and high. We're getting lots of coverage there. These aren't for use for sterile purposes. They're just for the proper fit. Now your level 4 disposable surgical gown. This style specifically has some Velcro at the top, so you can Velcro it nice and high up around your neck, getting as much coverage with that surgical cap to protect your neck. This might be where you have to have a buddy to help you out. You're going to apply knee-high operating room booties, pulled up as high as possible. Didn't mention before, but make sure your shoes are only hospital shoes. They're not going anywhere else. Good. Surgical gloves now on top, creating maximal overlap with your sleeve. Typical Tracy fashion. Looking good. Now, a slightly oversized nitrile glove. You getting hot yet?
Yeah, it's pretty hot.
So this is the pair of gloves that is going to be removed immediately after intubation. Okay. You look good. Great, Tracy. You're done.
Thanks.
Now we can doff. So that outermost nitrile glove is going to be removed immediately after intubation. Great. So now you're ready to leave the room. You're staying in 337 and moving over to our hand hygiene and laundry bins and garbage. You're doing hand hygiene on the gloved hands. You're now going to remove, we have to remove gown. To remove the top layer of gloves. No? Okay. We're going to remove the gown. So untie at the side. Trying to keep your chin up so that you're not contaminating your face on your gown. Leaning slightly forward and pull down over your shoulders, trying not to touch the outer surface of your gown. And these are Velcro, so they should pull off. And again, rolling them down and away from your body.
And pulling the outer gloves off with it.
And, okay, there we go. Yep.
Are they coming off? Oh.
They didn't come off, that's okay. So ideally we would put the outer gloves, which are over top of the gown, would come off with it. If they don't, then I would perform hand hygiene again. And then take those outer gloves off. Touching just the inside of them.
Just the outer layer. Yep. There you go. And hand hygiene again on the gloved hands. Now you're going to remove your knee-high OR booties, being very careful not to touch your scrubs or shoes if possible, and being very careful of your chin touching your chest. Nicely done. Now perform hand hygiene. Remove OR hood. So that's that single tie that you have at the back of your head. Again, trying to keep your chin up from touching your chest. This is another spot where you might need your buddy to reach for you after hand hygiene. So once that tie is loosened, bend forward at the waist so they can fall forward. And with your eyes closed, you're gonna pull that hood from the top of your head and drop it into the garbage. Perform hand hygiene on gloved hands.
So funny.
Remove bouffant or bandana style hair protection. Again, leaning forward over the garbage, close your eyes and pull off from the top of your head, dropping straight into the garbage. Perform hand hygiene on gloved hands. Remove mask with attached visor. Again, leaning forward, close your eyes. Don't touch the front surface of the mask or shield. Pulling it slowly and straight away from your face and dispose into the garbage. Perform hand hygiene on gloved hands. Remove gloves, ensuring not to touch outer surface. Perform hand hygiene on now bare hands. There you go. There you go, there you go. What about the knuckles? Nice. Now you're exiting the negative pressure room, going into the anteroom. Use your hand to touch that handle. Don't use your elbow. Nice. Repeat hand hygiene on bare hands in the anteroom. Now removing goggles, ensuring not to touch the front surface of your goggles. Touching from the side, there you go. Lean forward, close your eyes, and then pull them straight away and down. Place them in our used goggle bin for reprocessing. Perform hand hygiene on bare hands. Now you're removing your N95 mask. So lean forward again with eyes closed. Remove that lower strap, generally keeping a little bit of tension on it so that you can be pulling it down and away from your face, and dispose. Repeat hand hygiene on bare hands. And exit the anteroom and repeat hand hygiene after exiting the anteroom.